environmental toxins. For example, number one, heavy metals like lead, arsenic, cadmium, and mercury. Heavy metals cause oxidative stress, leading to DNA, protein, and membrane damage. So these metals generate reactive oxygen species such as superoxides, hydroxyl radicals, and hydrogen peroxide. These deplete antioxidants like glutathione. For example, cadmium disrupts mitochondrial electron transport. This leads to electron leakage, hence Ross generation. Lead displaces essential metal ions like calcium and zinc from antioxidant enzymes, hence reduced Ross neutralization. This leads to breakdown of DNA strands, protein denaturation, lipid peroxidation, hence cell death or dysfunction in fibroblasts, keratinocytes, and endothelial cells. Secondly, heavy metals cause inhibition of enzymes, which leads to blockage of cell metabolism. So metals like mercury, arsenic, and lead bind to sulfhydryl groups in enzymes. This alters enzyme structure, blocking its catalytic activity. Arsenic inhibits pyruvate dehydrogenase, which leads to blockage of ATP production. Lack of ATP leads to energy deficiency in fibroblasts and keratinocytes, leading to impaired proliferation and collagen synthesis. Number 3, heavy metals cause impaired angiogenesis and fibroblast formation. So these metals disrupt vesicular endothelial growth factor signaling, like cadmium and arsenic damage endothelial cells and reduce nitric oxide availability. This leads to impaired vasodilation and angiogenesis. Additionally, lead and mercury interfere with fibroblast gene expression and collagen deposition. So in summary, heavy metals damage endothelial progenitor cells in the bone marrow, which leads to fewer new blood vessel formation, hence poor tissue granulation formation, fragile scars, and chronic ulcers. Number 2, pesticides and industrial chemicals. So pesticides and industrial chemicals cause cytotoxic effects, leading to direct cell death. So pesticides like organophosphates and carbamates, as well as industrial solvents like benzene, toluene, are lipophilic, hence allowing them to penetrate cell membrane. This causes mitochondrial dysfunction, ATP depletion, and apoptosis. Solvents as well dissolve lipid membrane, leading to keratinocytes and fibroblast death. This affects repair of cells, hence delayed re-epithelialization and weak extracellular matrix formation. Secondly, pesticides alter growth factor and cytokine regulation. So many pesticides and industrial toxins act as endocrine disrupting chemicals. They mimic and block hormones like estrogen, cortisol, and thyroid hormones. For example, dioxins bind to estrogen, which alters transcription of cytokines and growth factors. Hence, disruption of transforming growth factor beta and vesicular endothelial growth factor signaling needed for fibroblast activation and angiogenesis. This impairs collagen deposition, weak extracellular matrix remodeling, and delayed granulation tissue. Number 3, immune suppression. Chronic pesticides or industrial toxins exposure reduces T cell proliferation and macrophage activation. For example, organochlorides like DDT accumulate in fatty tissue and impair thymus function. Hence, fewer T cells are produced. Benzene damages bone marrow, leading to decreased white blood cell production. This reduces bacterial clearance, enhances or leads to persistent infections and prolonged inflammatory phase. And this affects the progression of wounds to proliferation phase. Number 4, pH and wound environment. Healing is optimal in a slightly moist neutral pH environment. Highly alkaline or acidic wound dressings can impair cellular activity and enzyme function. For example, wound healing is best in a slightly moist environment with a neutral to slightly acidic pH between 5.5 to 7.0. That pH favors fibroblast proliferation, keratinocyte migration, angiogenesis, and enzymatic activity, like collagenases and growth factor-related enzymes. Whereas highly alkaline wound environment with the pH increased up to 8, fibroblasts and keratinocytes are inhibited. So alkalinity reduces cell motility and proliferation. Bacterial growth. Many pathogens, for example, Pseudomonas, Staphylococcus aureus, thrive in alkaline condition. This increases the risk of infection. Additionally, reduced oxygen release. Hemoglobin releases oxygen less efficiently in alkaline states. This leads to poor tissue oxygenation. This results into delayed tissue granulation, chronic wounds, and increased infections. Thirdly, highly acidic wound environment. Reduced pH up to around 5. There is enzyme inactivation. Key wound healing enzymes like proteases and growth factor activating enzymes work poorly in strong acidity. Secondly, in a highly acidic environment, there is cell membrane damage. Excess hydrogen ions disrupt cell membranes and extracellular metabolism. Additionally, fibroblast suppression. Acidic environment reduces collagen synthesis, as well as angiogenesis impairment, whereby endothelial cells are sensitive to acidic pH. This leads to fewer new blood vessel formation. This results into necrosis, poor cell migration, and impaired epithelialization.